Okay, now can you hear me? Okay, I suppose you can hear me. G. Yes, ma'am. Okay, thank you, my dear. Thank you so much. God bless you. So, I was talking to you that next Tuesday, 19th of May, before we break up for the Eid holidays, 19th Tuesday, you will have your first substage in head and neck. उस substage का syllabus में you have the skull, the mandible, the cervical vertebrae, all the bones that you've done. Besides that, you have the face, the skull, all everything related to the face and skull, the muscles, the nerves, the blood supply, etc. Then you have temporal fossa and infratemporal fossa. Infratemporal fossa, everything included in the infratemporal fossa, namely the muscles of mastication. Then you have the maxillary artery, mandibular nerve, all the branches of the mandibular nerve, the otic ganglion, pterygoid venous plexus, and whatever I've left out. ठीक है? पेज नंबर मैं आपको इसलिए नहीं बता रही हूँ बेटा because I have a different edition, you have a different edition. So I don't know कि आपके edition में पेज नंबर क्या है, मेरे edition में क्या है. But anyway, but the bad thing is that I've checked your papers, sub-stage के भी and final stage के भी. SEQ papers की बात कर रही हूँ. And you guys made a brilliant effort. It was an absolutely brilliant effort in copying and pasting from Google. Okay, so I know everything. जो आपने copy paste किया है, I know everything. And you will not be given marks for that. अच्छा जी. So we were talking about the vaccinator arising from the alveolar processes of the maxilla and the mandible and the pterygomandibular raphe. This is the pterygoid bone. This is the mandible, इसका cut section है. This white structure is the raphe. Raphe is simply where you have interdigitations of fibers. So यहाँ पे interdigitation of fibers between the buccinator, this is the buccinator muscle, and this gray muscle is the superior pharyngeal constrictor, superior constrictor of the pharynx. Okay? These two muscles interdigitate at this point and give rise to this raphe. ये जो raphe है, this is simply a thickening in the buccopharyngeal fascia. Okay? Now this muscle, the buccinator, this is the buccinator muscle, this quadrangular muscle. Over here it is this muscle. Because this is a deep muscle, so deep that it is in contact with the mucous membrane of the mouth cavity. Okay, buccal mucosa. Anteriorly, this buccinator, this mingles with this muscle, which is the Orbicularis oris muscle. ये देख लीजिए, buccinator is mingling with the Orbicularis oris muscle. Now, at the lateral angle of the mouth, ये mouth है ना, these are the lips, ये mouth है. At the lateral angle of the mouth over here, approximately 9 muscles, they cross each other. The fibers of these muscles, they cross each other. ये देख लीजिए, different muscles crossing at the lateral angle of the mouth. This lateral angle of the mouth, where the muscles cross each other, is called the modiolus. Modiolus. This is the site where, when the fibers in this place separate, in this area, when the muscle fibers separate, you get a depression in the cheek, which is called dimple. जो cheeks में गड़े पड़ जाते हैं. Buccinator का action, it presses the cheek against the molar teeth. Excuse me. These cheeks are pressed against the teeth. Okay? The food, by compression of the cheeks, the food stays out of the vestibule. But a vestibule is the area in the mouth, inside the mouth, between the cheek and the teeth, या gums. Outer surface of the gums or inner surface of the teeth के दरमियान जो area है, that is called the vestibule of the mouth. So by pressing the cheek against the teeth, this muscle makes sure that the food stays away from the vestibule, out of the vestibule, and hence it will stay inside the mouth cavity, within the teeth, onto the top of the tongue. When blowing, it will resist this distension of the cheeks, over distension of the cheeks. Okay? Blowing may, it will keep the cheeks firmly. Otherwise, अगर ये cheeks firmly नहीं रखेगा, taut नहीं रखेगा, तो then excessive bulging when you're blowing a trumpet or a bugle, whatever. Okay? So by keeping the cheek taut, की जो mucous membrane है, this also remains. It prevents the mucous membrane from folding. Or smiling may, it plays a role, and the nerve supply to this muscle is the buccal branch of the facial nerve. Okay? Okay. Platysma, it is this muscle is the platysma muscle. This covers the upper part of this pectoralis major, and this is the deltoid. Arises from the fascia on the upper part of the pec major and the deltoid muscle, and inserts over here, lower margin of the mandible. Either. ठीक है, some fibers going to the lateral angle of the mouth. ये देख लीजिए. By and large, angle of the mouth पे होता है. Some fibers go up to the lateral angle of the mouth. It is the two muscles converge towards each other, and then the midline they overlap. But over the neck and over the chest, there's a gap between the two muscles, which is, this gap is filled by fascia, interplatysmal fascia. Okay, so this is the platysma. It is supplied by the cervical branch of the facial nerve, and the action of this muscle is, obviously, since it is attached to the margin of the mandible, when the muscle contracts, it pulls the mandible down. In other words, it depresses the mandible and the lower lips, and of course the angle of the mouth. Yeah. When it contracts, it produces vertical lines on the neck. This is what it looks like. Ashaji, now the muscles related to the orbit, the openings of the orbit. The structure that you see immediately when you look at the eye is the eyelids. Okay. These are the eyelids. The main function of the eyelids is protection. Protects the eye against anything, a strong wind, a strong light, whatever. Okay. Besides, it helps to keep this is the cornea. ये cornea है. And the white part is the sclera. Okay? So it helps to keep the eyeball moist. और वो इस तरह कि this is the lacrimal gland. It produces a fluid, watery fluid called tears, ansu. This watery fluid passes via these ducts into the eye, over the surface of the eye. These two lids, they help to spread this fluid over the surface of the eye. The eyelids close in a sequence starting from the lateral end. The lateral end closes first, and then gradually the medial end closes. As a result, the fluid is spread from the lateral side to the medial side. Okay? Because this lacrimal gland that produces tears is present on the lateral side, so fluid is first received by the lateral part of the eye, and with the blinking of the eyelid, closing of and opening of the eyelids from the lateral side to the medial side, the lacrimal fluid or tears are spread from the lateral to the medial side of the eye. From here, the tears pass into this lacrimal punctum and then into this structure, which is the nasolacrimal sac, lacrimal sac, and then into this duct, which is the nasolacrimal duct. Okay? अब ये जो part है ना, part of the eye between the two eyelids, ये सारा part, ये area, this is called palpebral fissure. This is simply an opening between the two eyelids. अच्छा जी, muscles पे आ जाते हैं. The muscle of the eye is called Orbicularis Ocular. Orbicularis Oculi. It runs in concentric circles around the eye, around the orbital margin, and in circles around the eyelids. Okay? It has three parts. The palpebral part is the part which is related to the eyelids. ये eyelids है. Okay? This is the palpebral part. Anteriorly, this is the tarsal plate that keeps the eyelid a little firm. अच्छा जी. So this muscle, the palpebral part, this is the palpebral part of the orbicularis oculi, starts over here on the medial side from this ligament, which is called medial palpebral ligament. Here. The muscle arises from here, encircles the eyelid, comes on the lateral side, upper lid cavity, arising from the medial palpebral ligament, encircles the lower lid, comes to lie laterally, lateral aspect way. The upper fibers and the lower fibers, they interdigitate with each other and they form a raphe, lateral palpebral raphe कह लें या जो मर्जी कह लें बाहर. So एक concentric circle में ये आपको eyelids के muscles, palpebral part milega. And the function of the palpebral part is simply to close the eyelid gently, like when you do it in sleeping. Yeah, blinking makes. Then comes the orbital part. This is the orbital part. The orbital part is part which is resting on the orbital margin. The orbital margin है ना बेटा, it is resting. Arises from the frontal process, frontal bone. Yeah, because you know the front orbit, the margin of the superior margin of the orbit is formed by the frontal bone. ये सारी frontal bone है. So it arises from the frontal bone and inferiorly it arises from the maxilla. Okay? And encircles the orbit like this. इसका function है, it tightly closes the eye so that the eyelashes are buried inside the eyelids. We do this to prevent the eye from strong wind or glare, तेज रोशनी या उससे prevent करने के लिए we tightly close the eye. Nerve supply of this muscle, Orbicularis Ocular, is from the zygomatic branch of the facial nerve. अब आपको बताया था ये lacrimal gland है, these are the lacrimal ducts, lacrimal canaliculi हैं, duct नहीं बेटा, lacrimal canaliculi हैं. Tears are produced in the lacrimal gland, travel via these lacrimal canaliculi, enter the eyeball, surface of the eye. This is how they pass from the lacrimal over the surface of the eye into the lacrimal punctum and then the lacrimal sac and then into the nasolacrimal duct. ये root है because these tears keep the eye surface of the eyeball moist. They are being produced all the time. We are not aware of it because partly they are drained into the lacrimal sac and partly they are evaporated. So the third part of this muscle is the lacrimal part. These fibers, medial side के fibers हैं, posterior to the lacrimal sac. ठीक है? And they compress the sac. As a result, tears from the sac pass down into the nasolacrimal duct. And that's how it keeps the tears in circulation. अच्छा जी, muscles of the nose and ear. Muscles of the ear in humans are very well developed. Multiple muscles are superior, whatever, but human beings they are not very well developed because human beings we do not move our ears. Lower animals they are very well developed. Okay? Animals they are well developed, humans not well developed. Muscles of the nostril. This is the nasalis. Then comes your dilator nares, levator labii superioris, ये वाला muscle. Depressor septi over here, these muscles. All these muscles are, of course, ये कोई इतने well developed नहीं है. ये है action, ठीक है? Flaring of nostrils. बस जब गुस्से में आके आप नाक को फुलाते, that is the only action of these muscles. Nerve supply comes from the buccal branch of the facial nerve. Now this is a list of the entire muscle of the face. All you have to do is just remember, you should know the names, उनको identify कर लो. That's about all. Nerve supply मैंने आपको बता ही दी है. Individual muscles की organ insertion is not required. इसकी ज़रूरत ही नहीं होती. लेकिन groups of muscles you should know. You should know the orbicularis ocular. You should know the orbicularis ocular. जो important muscles हैं वो मैंने आपको करवा दी है. And this is a very good drawing of actions of all the muscles that you have on the face. ठीक है, ये आपकी किताब में से ही ली है. It's a very good one. Let's come to the nerves. So far, do we have any questions? Okay. Nerves of the face. Beta, you have sensory nerve supply, you have motor nerve supply. The sensory nerve supply is via the trigeminal nerve. The trigeminal nerve is a cranial nerve number 5. So the 5th cranial nerve is the trigeminal nerve that gives spontaneous innervation or sensory nerve supply to the face. Then comes the motor nerve supply. The motor nerve supply, that is nerve supply to the muscles of the face. That is via the facial nerve. The facial nerve is the 7th cranial nerve. Cranial nerve number 7 is the facial nerve. But you have to remember the numbers of the cranial nerve. Every cranial nerve has a number. Okay? Olfactory is the first, optic is the second. Optic first नहीं होगी, वो second है और second ही रहेगी. Trigeminal 5th है, glossopharyngeal 9th है. So आपको इस order में ये याद करने हैं. रटा है, purely रटा है, but you have to do it. अभी के लिए आप 2 याद रख लीजिए. 5th is trigeminal and 7th is facial. One by one, let's do these nerves. The cutaneous nerve supply of the face and scalp. I told you the cutaneous innervation of the sensory nerve supply comes from the trigeminal nerve. Now the trigeminal nerve, it arises from the pons and the midline. pons and midbrain are parts of the brain. ठीक है, अभी के लिए इतना ही याद रख लीजिए, इसकी डिटेल्स हम बाद में कर लेंगे. From the pons and midbrain. It arises by two roots, a large sensory root and a small motor root. Okay? We'll talk of the sensory root because that supplies the cutaneous innervation to the base. ये जो sensory root है ना, it is formed by the peripheral processes. अब आपको पता है कोई भी रिले स्टेशन हो, गैंग्लिया हो, उसके पेरिफेरल प्रोसेस होता है, एक उसका सेंट्रल प्रोसेस होता है. पेरिफेरल प्रोसेसेस ब्रिंग इन impulses. So from the face, cutaneous sensation comes via these peripheral processes and comes into this ganglion, which is trigeminal ganglion. These relay over here in the ganglion, then postganglionic fibers make up the sensory root. ठीक है, मैं फिर रिपीट कर देती हूँ. Peripheral processes of this nerve, they bring sensations from the space. जी नहीं, शेयर नहीं हुई हुई. मैं अभी गई है यहाँ पे शेयर हो जाएगी. ठीक है, जी बेटा. Okay, fine. Now can you see the screen? चलो जी, हम Thank you, Vita. Now let's continue. So the sensory fibers, the sensory innervation from the face, skin of the face. It travels by these peripheral processes. These peripheral processes, they join together and make three nerves. Trigeminal, tri means three. They form bundles of fibers, a nerve fiber, 1, 2, 3. These fibers then go and relay in this ganglion. This is the trigeminal ganglion. यहाँ से postganglionic fibers, they make up the sensory root. ठीक है? So the peripheral processes, I told you, they connect together, they form a nerve. Three nerves. The first nerve is ophthalmic. The second nerve is number 2, maxillary, and the third nerve, number 3, the thicker one. This is the mandibular. I repeat once again, the smallest, the most superior nerve, ophthalmic. The middle one, number 2, is maxillary. And the lowest, the largest, the thickest, this is the mandibular nerve. And all these nerves, they go and relay in the trigeminal ganglion. This is the trigeminal ganglion. Okay, dear. So the ophthalmic. Now the ophthalmic trigeminal is fifth cranial. Okay, so CN is Cranial nerve, this V is Roman for 5. Cranial nerve, fifth A, first division. The first division of cranial nerve number 5, which is trigeminal, is the ophthalmic division. Here, this is the ophthalmic division, cranial nerve 5E, first division. Second is maxillary. Here. So when you read this CNV2, cranial nerve 5E, second division, automatically you should understand it means the maxillary division. Okay. Okay. And then comes cranial nerve 5E, third division. This is the third division of cranial nerve number 5. This is one by one. The ophthalmic nerve, cranial nerve 5, the first division, is a purely sensory nerve. Okay? It is a purely sensory nerve. Cranial nerve 5 is second division, maxillary. Once again, it is a purely sensory nerve. And the third division of cranial nerve 5, which is the mandibular nerve. It is partly sensory and partly motor. That means it's a mixed nerve. It has sensory fibers for the innervation of the face, and it has motor fibers for the muscles of mastication. So this is how they are distributed, Vijay. Like the first division, cranial nerve 5, the first division, which is ophthalmic. Here, area of the forehead, including the upper eye and part of the nose, a green major. This is supplied by ophthalmic division. This over the maxilla. This is the maxillary division, cutaneous innervation. And over the mandible and side of the temple, this is the mandibular division. Okay, this is how they are distributed. And this is what they are. This is the trigeminal ganglion, ophthalmic division, maxillary division, mandibular division. Ophthalmic division leaves the skull through the superior orbital fissure. Maxillary division leaves the skull through the foramen rotundum, and mandibular division leaves the skull through the foramen ovale. So this is the cutaneous innervation of the face. This is supplied by the ophthalmic division up to here. Now the vertex, this is the vertex. Vertex is the highest point on the skull. You get the highest point on the head is the vertex. You draw a line from the ear passing to the vertex and onto the other side of the ear. From the top of the auricle, ear or auricle or pinna. From the top of the auricle, you draw a line passing over the vertex. This is the highest point of the skull. This is the vertex, and going on to the pinna of the other side. Yes, this is the line of demarcation. Anterior to it, the face and scalp is supplied by the branches of trigeminal nerve. Posterior to this line, the scalp and part of the neck is supplied by cervical plexus, the branches of the cervical plexus. अभी आ जाते हैं इस पे. Any questions so far? Okay, ji. Branches of the cervical plexus पे आ जाते हैं. I told you they supply the skin of the back of the scalp and partly the neck as well. This इस orange में this area, this is supplied by the greater auricular. ठीक है, इसमें greater auricular जो है that supplies the lower part of the auricle, नाम ही greater auricle है. ठीक है, angle of the jaw, ये यहाँ पे mandible का angle है, angle of the mandible, and over the parotid region. This is the area we have the parotid gland. Okay, over here. So over the parotid region, angle of the mandible, lower part of the ear. All this is supplied, and even over here, the skull above the auricle. All this is supplied by the greater auricular nerve. This is the greater auricular nerve. It even supplies the fascia covering the parotid or the capsule of the parotid gland. Actually, one by one, let's do the branches of the ophthalmic nerve. Cranial nerve, 5T, first branch. This is the ophthalmic branch, ophthalmic nerve. First branch is the smallest branch. It is purely sensitive. I told you already. Okay. It passes into the orbit through this fissure, which is the superior orbital fissure. From here, it enters the orbit. In the orbit, it divides into three branches. The frontal nerve, the lacrimal nerve, and this is the nasociliary. This is the nasociliary. These are the three branches. Frontal, lacrimal, and nasociliary. Beta, you have to remember the names of this nerve and the area that they supply. Very important. Okay. So first cranial nerve की frontal branch पे आ जाते हैं. Frontal branch of the first cranial nerve, ophthalmic. Trigeminal की first branch. ठीक है. Trigeminal की first branch जो है उसकी frontal nerve. The frontal nerve, this is the frontal nerve, is the largest of the three nerves. Cutaneous की branch कर रही हूँ. Enters the orbit through the superior orbital fissure, runs over the roof of the orbit. In halfway down the margin, this is the margin of the orbit. So halfway down the margin of the orbit, it divides into two branches. So the frontal nerve running in the roof of the orbit divides into two. The medial branch is the supratrochlear. The lateral branch is the supraorbital. The supratrochlear is medial, supraorbital is lateral. Supratrochlear supplies a midline area of the forehead and upper part of the eye as far as the hairline, or where it should be. जहाँ पे आपसे माथे पे से बाल शुरू होते हैं, वहाँ तक midline में जो strip है, that is supplied by the supratrochlear, the medial nerve, supratrochlear. It also supplies part of the eyelid and conjunctiva. The supraorbital जो है, that is the lateral of the two branches. ये supraorbital है. It supplies the frontal sinus, the skin over the forehead as far as the vertex. ठीक है, वो सारी skin जो है, that is being supplied by supraorbital, plus the middle part of the upper eyelid, and the medial part of the eyelid by supratrochlear, and the middle part, itna part है वो by supraorbital. Nasociliary पे आ जाते हैं. This is the nasociliary. This the nasociliary divides into posterior ethmoidal, anterior ethmoidal, and infratrochlear. इसकी 3 branches होती हैं. Anterior ethmoidal जो है that ends as external nasal. The external nasal जो है ये terminal branch है anterior ethmoidal की, and this supplies skin over the dorsum of nose. ये आप देख लीजिए, over the dorsum of the nose up to the tip. इतना हिस्सा जो है वो external nasal से supply होता है. The infratrochlear, this is the infratrochlear nerve. It is the infratrochlear nerve is the terminal branch of the nasociliary. ठीक है, so nasociliary ends as the infratrochlear. The infratrochlear branch जो है ये, this supplies the lateral part of, ये root of the nose है ना बेटा, जहाँ से nose शुरू होता है, root of the nose. This is the root of the nose, so it supplies the lateral part of the root of the nose, skin and conjunctiva of the. ये जो medial part of the eye, medial angle of the eye, ये जो, this is called the medial canthus. ये जो medial canthus है ना, ये है, this is the medial canthus. ठीक है, so इसको supply करती है, lacrimal sac को supply करती है. All this is supplied by the infratrochlear. Then the third division of ophthalmic nerve, that was the lacrimal nerve. ये lacrimal nerve आपको बताई थी. The lacrimal is the smallest branch. It supplies fibers to the lacrimal gland. Secretomotor. It supplies motor fibers that stimulate the gland to secrete its secretions, produce its secretions. That is why it is called secretomotor. Motor fibers to the gland. Ab motor fibers to the gland, beta, would be a parasympathetic supply. Okay? To the glands that stimulates the glands to produce its secretions. So ये lacrimal gland को secretomotor fibers देता है. Skin को, however, this nerve, the lacrimal nerve, supplies a small part of the skin, lateral part of the upper eyelid. So हमने किया था कि upper eyelid was being supplied by 3 nerves. Medial most was supratrochlear, middle part was supraorbital, lateral part of the eyelid was lacrimal nerve, and the medial canthus was being supplied by the infratrochlear nerve. Maxillary division, the second division of the trigeminal ganglion or the trigeminal nerve. So, cranial nerve, fifth key, second division के हम बात कर रहे हैं. This is the maxillary nerve. It is a purely sensory nerve arising from the trigeminal ganglion, runs forwards, passes through the foramen rotundum in the greater wing of sphenoid. This is the foramen rotundum. ये skull है. This is the foramen rotundum. This is the foramen rotundum. ठीक है? So it passes through the foramen rotundum, passes forwards, and enters this area, which is the pterygopalatine fossa. ये pterygoid plate है, ये maxilla है. इन दोनों के दरमियान ये जो है ना, this is called the pterygopalatine fossa, जिसमें ये pterygopalatine ganglion बना. ठीक है? So this maxillary nerve enters the pterygopalatine fossa, gives branches to this pterygopalatine ganglion. ये maxillary nerve है ना बेटा, ये सारी maxillary nerve है. So it is giving branches to the pterygopalatine ganglion, and then it continues forwards, enters this part which is the inferior orbital fissure, and enters the orbit. Okay? Now it gives a zygomatic branch. ये देख लीजिए ये that divides into two. ये zygomatic branch है. This zygomatic branch divides into two. Zygomatico-temporal, ये, and this is the zygomatico-facial. And then the maxillary nerve in itself, after giving off this zygomatic branch, is continue forwards, leaves the orbit via the infraorbital foramen, comes out onto the face as infraorbital nerve. मैं फिर repeat करती हूँ. Maxillary nerve arises from the trigeminal ganglion, runs forwards, passes through the foramen rotundum, still enters the pterygopalatine fossa. Pterygopalatine fossa, in the fossa, it gives branch to the pterygopalatine ganglion. It also gives a branch to the zygomatic branch that divides into a zygomatico-temporal and a zygomatico-facial nerve. Then the maxillary nerve runs forwards, enters the orbit through the inferior orbital fissure, enters the orbit through the inferior orbital fissure, runs in the orbit and leaves the orbit through the infraorbital foramen, continues on the face as infraorbital nerve. Zygomatic nerve की बात कर रहे थे. इस पिन को फॉलो कीजिए. Divide this with the zygomatic nerve. It divides into two: the zygomatico-temporal and zygomatico-facial nerve. The zygomatico-temporal nerve gives a communicating branch to this lacrimal nerve. ये lacrimal nerve है. ठीक है. So the zygomatico-temporal gives a communicating branch to the lacrimal nerve. ये जो है, this supplies secretomotor fibers to the lacrimal gland. ये lacrimal gland है that produced tears. And then is the zygomatico-facial. This supplies this area over the skin of the face. Okay? Prominence of the GQ पर ये supply कर देते हैं. जबकि जो zygomatic-temporal है ना, on the face it supplies the temple, the hairless part of the temple. Infraorbital, इसकी ये आपको बताया था. The maxillary emerges onto the face via the infraorbital foramen. अब ये इसकी distribution देख लीजिए आप. It supplies branches to the maxillary sinus, to the maxillary teeth. Maxilla को supply कर रही है. नाम ही maxillary है, so it supplies the maxilla. Hence, it supplies the maxillary teeth, lower eyelid, skin of the cheek, your nose, even the part of the nasal septum and the upper lip, lateral part of the upper lip. All this is the area of supply of the infraorbital nerve. Now let's come to the third branch of the trigeminal nerve, which is the mandibular nerve. Cranial nerve 5 की third branch. It is the ये है जी. It is the ये ganglion हो गया. This is the fragment division. ये maxillary division, and the blue one is the mandibular division. The largest nerve leaves the foramen leaves the skull through the foramen ovale. ठीक है? Foramen ovale is also in the greater wing of the sphenoid. It is a mixed nerve. आपको बताया था. The part supplies the muscles of mastication. However, the sensory part of the mandibular nerve supplies cutaneous innervation to the face via 3 nerves. Auriculotemporal. Yeah. This is the auriculotemporal. This is the buccal nerve. This one. And ये जो है ना, ये. This is the mental nerve. Okay, I repeat once again, three branches of the sensory branches of the mandibular. ये auriculotemporal है, this one, the buccal nerve, and the mental nerve. This is the mental nerve. So by the way, all these drawings are taken from the internet. अच्छा जी, distribution कर लेते हैं जल्दी से. Let's finish up with this. The auriculotemporal nerve. This is the supply of the auriculotemporal nerve. Auriculo, that means auricle, and temporal. Now this nerve passes deep to the ramus of the mandible. ये mandible है, ये ramus over here. So it passes deep to the ramus of the mandible and the parotid gland. So यहाँ parotid पड़ा हुआ था, deep to the parotid gland. It supplies the skin anterior to the auricle. ये सारा part of the auricle also, upper part of the auricle. ठीक है. Plus posterior 2/3 of the temporal region. Anterior 1/3 को तो हमने पहले फैसला कर लिया था. ठीक है. जो hairless part of the skin का. अब ये जो posterior 2/3 of the auriculotemporal है, of the temple है, plus part of the skin anterior to the auricle, part of the auricle as well. Parotid gland को ये supply करती है. It is passing deep to the parotid gland, so it supplies the fibers to the parotid gland. Secretomotor. These fibers stimulate the parotid gland to produce its secretions. इसलिए इनको secretomotor fibers कहते हैं. And then you have the buccal nerve. This is the buccal nerve. ठीक है. This buccal nerve skin को supply करती है, plus mucous membrane of the mouth. Oral means mouth. Oral mucous membrane. कौन सा part? That part of the cheek which is lying over the buccinator muscle. So इतना area जो है ना, that is being supplied by the buccal nerve. Plus gums को supply करती है. अब ये जो है molar teeth आपकी second and third molar teeth, इनके gums को भी ये supply करती है. And the last is this mental nerve. The mental nerve, it's easy to understand, supplies the chin, it supplies the lower leg, mucous membrane of the lower leg. Facial nerve पे आ जाते हैं. Facial nerve is the motor nerve. ठीक है. अब this nerve है तो ये mixed nerve, लेकिन face के लिए motor है, because it supplies all the muscles of facial expression. Also muscles of facial expression, also muscles of the scalp. The facial nerve leaves the cavity, orbital cavity, through this foramen lying between the mastoid process, and this is the styloid process. So this foramen is lying between the mastoid and the styloid process. This is the stylomastoid foramen. The facial nerve emerges through this foramen and gives off a posterior auricular nerve which supplies the auricular muscles of the ear, posterior auricular muscles. Plus also supplies this muscle, the occipital belly of the occipiter frontalis, इसको भी supply करती है. And then it enters the parotid gland, where it divides into 5 branches that make up the parotid plexus, also called pes inserinus. The 5 branches of the facial nerve, the 7th cranial nerve, are: this is the temporal, this branch is the zygomatic, this is the buccal, This branch is the marginal mandibular, and this is the cervical branch. एक एक करके इनका area of distribution कर लेते हैं. The temporal branch arises from the superior border of the carotid gland, crosses the zygomatic arch. Okay, zygomatic arch. Please note it is crossing the zygomatic arch, and it divides into two branches. The frontal branch and the parietal branch. The frontal branch supplies the muscles of the auricularis anterior and superior. This is the site where the ear or pinion, the auricle should have been. So the temporal branch gives nerve supply to the auricular muscles, to the frontal belly of the occipital frontalis, plus the superior part of Orbicularis Ocular. You see the branch going over there. Frontal belly of occipital frontalis and Orbicularis Ocular. Then comes the zygomatic branch. Zygomatic branch divides into two or three branches. ये देख लीजिए ये zygomatic branches हैं. The main supply is to the orbicularis fibers, जो lower lid के fibers. ठीक है? And then the muscles of facial expression below the orbit as well. The thing to remember is if you damage this nerve, zygomatic nerve, the lower fibers of the orbicularis oculi will be paralyzed. With the result, the eyelid will fall apart. It will not be resting on the eyeball. So, person will not be able to blink. Blinking nahi hogi, and when there is no blinking, the tears cannot be spread onto the surface of the eye. When the tears cannot be spread onto the surface of the eye, they simply roll down the cheek. As a result, the eyeball and the cornea, that becomes dry. And when it becomes dry, ulcers develop over it. Corneal ulcer बन जाते हैं over the cornea, which may lead to blindness. Buccal branch, the facial nerve, the buccal branch running over the, supplying the area over the buccinator. Okay. Plus levator, plus this the buccal branch also supplies the, एक तो buccinator को supply कर रही है, plus orbicularis porus को supply कर रही है. इसको भी supply करते हैं, levator labii superioris. So it supplies all these. This is the marginal mandibular. Okay. On the mandible, running forwards deep to the platysma. Emerges from the lower border of the parotid. Deep to the platysma, running forwards, supplies the lower lip and chin. Yeah, lower lip. Motor fibers to the lower lip. If it is running along the lower margin of the mandible. In cases of incision over the lower margin of the mandible, this nerve is liable to injury. यहाँ पे submandibular gland होता है, उसका अगर operation करना हो, then we have to make an incision over there. In this case, this nerve is damaged. अगर ये nerve damage हो जाएगी, lower lip को supply कर रही है. This is what happens, drooping of the angle of the mouth. Then comes the cervical branch, which emerges from the lower, and supplies the platysma. We'll do the rest next time, inshallah.